Hi there. So the reason I've decided to make this channel, hi and welcome. First off, I unfortunately have been diagnosed with IBC, or inflammatory breast cancer, and I want to really let people know and spread awareness of this rare breast cancer that is in the IBC network in the US says no lump, still cancer. I really want people to, one, know about it so that they can look out for it, and two, let their friends and family know, because I was completely caught unprepared with this. It struck me by surprise. I don't have a huge family history of breast cancer. In fact, only my great grandmother on my maternal side had died of breast cancer, and it was in the 60s, early 60s or so. And so things like the testing of HER2 positive, hormone status, ER/PR negative or positive, same thing. It wasn't, as far as I'm aware, wasn't studied or gone through. So I just want people to know what to look for and how quickly they need to get onto things. So my story starts in April. Well, I think it was probably end of February or March. But I got diagnosed in April 13th, 2022. What had happened was I had symptoms. I waited 8 days to see my doctor, and it just continued to progress and get worse. The symptoms are very mild and vague, just kind of like an infection, just sore, swelling, redness, not really so much. So I never heard of this kind of cancer. So, cancer never came into my mind until I Googled symptoms. We all kind of are guilty of that. And I found something called IBC. And so I did wait the 8 days thinking still, oh, well, I had just turned 40, I'm young, I don't have a huge history of this. When my doctor saw it, even though I have an inflammatory condition, she knew right away that it needed to be looked at. And thankfully, she told me she wanted me to get a mammogram and ultrasound that week. And I actually was going to. However, she ended up calling me the next day and told me that she wanted me to go into the breast health clinic at the local hospital. So I went to that the following week, and then I believe they did the mammogram and the ultrasound there, and then they ended up doing a biopsy. They told me they might or might not do a biopsy, but I still had to wait another week to get results. And so they said it's either an infection or this rare kind of breast cancer, which is, I think it makes up about 4% of all breast cancer, but the stats are not great on it. It's the 5-year overall survival is 42%. So it's not something you can mess around with. It's a very aggressive cancer. And then I found out that I'm, oh, sorry for my kitten, HER2 positive. So HER2 positive is also very aggressive. So I ended up having 2 very aggressive kinds, and I'm ER/PR negative, which is the hormones. So that has different treatments and such. So what happened was we found out that, so the problem with IBC is it's either stage 3 or stage 4 cancer. Oh, sorry. My kitten is just having a heyday here on the table. I'm kind of frustrated, but yeah, I don't want to start the video over. Anyways, sorry. So I think where we left off was that I was ER/PR negative. And the problem is this cancer is either stage 3 or stage 4. So it's already, by the time it's caught, it's advanced because it's in the skin. It's kind of sneaky. I ended up with having 2 different kinds of cancer, DCIS, which is more common, and then inflammatory breast cancer, right? So what I really want to get across to people is that if they have any strange symptoms that even can look like infection symptoms, just get to the doctor, because you might as well. I mean, this has been featured in Grey's Anatomy, but I don't remember seeing it there. And it also was just in the Katherine Heigl show on Netflix, the one called Firefly Lane. Anyhow, so that's good. The word's getting out there, and that's what we need, and that's what we want. So what happens is that for inflammatory breast cancer, I immediately was rushed into treatment, and that was about 2 weeks later. 2 weeks after being diagnosed. And so they said it's either stage 3 or stage 4. And I said, well, I have a kid, so, sort of that's not an option, going to stage 4 or not being here. So what do we need to do? And so I started with the TCHP, which is the Taxol, Carboplatin, Herceptin, Perjeta, and that is standard chemo therapy and regimen as of 2022 it was anyhow, and I started around April 28th or 29th of that year. And then unfortunately my PICC line got infected. So the big thing is that I ended up being stage 3, and I was so thankful because they did a CT and bone scan for that 2-3 weeks. We were really, really on edge, and I can't explain what it feels like to be diagnosed with cancer, because it kind of feels a little bit like you're being hit by a truck, but then it's also it's such a weird juxtaposition because you're walking through the world, you look healthy, you're not like extremely thin and about to die or anything. So people have this idea in their head of what cancer looks like, and even myself, and walking around, people wouldn't think that I had breast cancer all of a sudden, like a very advanced one. So then it really gave me the perspective of really be kind to everyone, because you really don't know what they're going through. And anyway, so I did the TCHP, I got the PICC line infection, I was hospitalized for 5 days. That was a whole big thing. I was septic, so just from some sort of PICC line infection. So I'm not big on PICC lines. I have a port now, and I still have a port, and it's the best thing. It's the best thing. I don't know. It's the strangest. It just helps. It helps, and I don't have to worry about how they are going to get anything into me. And so I kept it by choice, just because I finished May 2023 with the Herceptin, because you have to do a whole year of Herceptin. So back to where I started. So we do the neoadjuvant chemo treatment of the TCHP. I did that, and I was told Herceptin is about 60% at getting rid of cancer, but if you add Perjeta, it's like an extra punch and could get you to 80%, but for some reason it's not covered by my insurance here. So unfortunately we had to pay out of pocket almost $13,000 for 7 sessions. However, now that I'm on the other side, like at the time, you're trusting the doctors, you can't think straight because it's so much. And I was trying to do research, but like I don't have the experience. I don't know what I'm looking at, what I'm doing. And now I would never have not taken Perjeta. So if that helps anyone, like I am not a doctor, I'm not a nurse. This is just my own, I'm not a medical professional. This is just my own experience. And I personally would never go through it again and not do Perjeta right away, or obviously Herceptin, but whatever is covered or not. So I'll just leave that there as food for thought. And so we did all that, and then I had to have my surgery in September of 2022. I had it September 14th, 2022, and I had the modified radical mastectomy on the right side, and then also the axilla. So they were supposed to take out all the lymph nodes according to the MD Anderson protocol from IBC network in the States, and that MD Anderson is the specialist. They are the worldwide specialist, and they say to take out all the lymph nodes. I did not realize they did a sentinel lymph node biopsy for an entire year, because again, you're trusting the doctors, it's too much information. So I was really upset in September 2023 when I realized they didn't do the right protocol, and that concerned me because it was already in my lymph nodes. So how many more was it in, and why didn't we just take them out? I did end up getting lymphedema in about April, May 2023, but that's not that big a deal. And I would have much rather, obviously, that they taken out all the lymph nodes so that I was safe. So after that, they told me that the breast tissue came back as being completely free and clear. So they called me no evidence of disease, which is awesome. NED for short, no evidence of disease, right? And so they can't obviously say you're completely cancer-free or anything till I think 5 or 10 years, or anyways, I'm sure it differs from country to country. However, I was really happy about that. And then I had to do the radiation. It was once a day. And then they had me using some kind of like barrier spray or protection, but really they shouldn't have done that, I don't believe, because again, IBC, inflammatory breast cancer, is in the skin. So you want to really fry the skin as much as possible. Sorry for like harsh words, it's just who I am, how I talk, right? So you basically want to burn the skin. And so they had me protecting it a bit, and then by the end of it I stopped so that I would really get to it. And now I'm not sure if that was correct either. So again, I want my story, my experience to be used by someone else, whether it's a mom or a grandma or a young woman. I just don't want this to happen to someone else. make sure if you're watching this and you're just going through it, please make sure that it's not a sentinel lymph node biopsy, because again, it's so much to think about. And I wasn't really like, I don't know all these medical terms. Like, I watch Grey's Anatomy and I know a lot of medical terms, but I don't know enough. I'm not a doctor, I'm not a nurse. And so unfortunately, I didn't even notice. I kept looking at my notes. I looked at things, didn't even jump out to me. Anyways, so they called me no evidence of disease, and same thing. I did the radiation treatment over, I did 25 of them with the bolus, and it, it wasn't very fun. However, we did it. And then I did Herceptin for the entire year. So I finished, I think it was May 12th of 2023. I was pretty much like discharged from the program, just call if there's a problem, and then do like a follow-up every 3 months. It was a very jarring experience in the sense of, you've been a cancer patient for a year, just like kind of came out of nowhere. And then all of a sudden it's kind of like, okay, you're fine, bye. Like, we got to worry about the other people. So it's very strange. There's a lot of hand holding, and then there's a lot of, you're just on your own. And it's, the way I describe it is you're kind of like on this timeline, not timeline, like you're living your life, everything's great. And then all of a sudden it's like you get jolted out. We're going over here now. Like, they told me, this is your full-time job for the next 6 months, right? Fighting this. And then, they kind of just like, you're okay. Okay, now we're done. And then they kind of just like throw you back in. It's the strangest thing. And they call, cancer survivorship, a strange experience, and not enough support on the other side of it. And I think, of course, like, you don't want to be the one who passes away from cancer. So, you should just be thankful and grateful and shut up, right? Is how you're kind of made to feel. But just because it didn't have a bad ending doesn't mean that you're not completely, it's very emotional. It's a lot to go through, and you kind of come out of it completely exhausted, emotionally exhausted, not physically the same, not emotionally the same. The funny thing about cancer treatment for breast anyways is that in a lot of our treatments is that it actually makes you gain weight, like 15, 20, 25, 30 pounds. And so, people think of cancer, you think of really skinny and dying, unfortunately. Like, that's the image that comes in my head anyways, and probably a lot of people's. And so you kind of come back out and you're just not the same. And so, you don't look the same, you don't feel the same. Like, I've seen women say they feel 10, 20 years older, they look 10, 20 years older, they're having their teeth chip out, they're having more lines and wrinkles, they're having like bone and joint pain, they're not coping well with, like, if you have a modified radical mastectomy, like in this case, like, you can't do reconstruction for 1 to 2 years because there's such a high chance of recurrence. And so, you just are kind of left feeling, I don't know, it's really strange, like almost mutilated, like it's the strangest thing. And then it's just like, okay, go back to normal life. And you kind of, like, you can't, like, you're not the same person that you were before. And then that takes a bit of time. And then also because cancer just snuck up on you and jumped out of the bushes kind of thing, that's how you kind of feel. Like, it's hard to relax and just go back to normal life and talk about, silly petty problems and like our own little world issues that we're having that you're not worried about when you're facing cancer. It's really strange. It took me a while. It took me, I would say, at least 5-6 months to start living again and not feeling like, okay, what appointments do I have? What, you just are, I was so discombobulated from it all that it took me a while. And then, so I was feeling great. I was no evidence of disease. I will post those videos as well on this channel just so you can see them. I was feeling awesome. I actually my oncologist decided, because it was affecting my heart, they wanted to do one less Herceptin for me. So that was great. But I was also like, wow, I'm done. Like, I'm done. Oh, I'm done. So again, like I just explained, cancer survivorship is a strange thing. So my heart goes out to everyone. And again, like, whether you have stage 0, 1, 2, 3, 4, like, cancer's cancer. It's scary. We all know someone who's like at least one person who's passed away from cancer. Like, I didn't have a high rate of breast cancer in my family. However, I did have family members die from other types of cancer. So like colon cancer, lung cancer, you know people. So, or like friends and family, or your friends, sisters, whatever, you just know people. So it's a scary thing, and it's not to be judged of like, oh, well, you had this one or that one. It's all scary. It's all scary, and it's all a very lonely experience. And had I not had, my other two illnesses, and also early in my life, like I know God really had that happen to me for a reason, so that it wouldn't be so hard for me, it wouldn't be so shocking. But it is like scary, and it's depressing, and yeah, I don't know if you have cancer, like my heart goes out to you. And if you know someone who has it, your loved one, also being on the outside looking in is very scary, but also know that, they might just need like an extra, you know, um, friendly invitation or hug, or, gesture, because it is a very scary and lonely experience. So anyways, after that, what happened was I was just trying to live my life, go back to normal family stuff. And in November, I had a very strange thing happen. I was starting to have a headache for a few days. And then I was out at an activity. We're driving home. And all of a sudden, I was like, please pass me a sweater. I feel like I'm going to barf. Like I felt sick all day. And then I just threw up violently while driving. Thankfully, I was at a stoplight, and it was kind of funny, but it was also like very, very, very strange. And so once that happened, we were only a few minutes from home, thankfully. So we would just drive home with the windows open. But then I just came home and had a quick bath and stuff, and like got ready to go to bed. I just felt really awful and strange. So I made sure to call into the cancer center the next day. And then I had an appointment with my oncologist the next week. So I told him again kind of how it happened, and he was about to discharge me to the monitoring program, or the I don't know what it's called, but basically like the program where they're basically watching you more than someone else who's not, the breast health clinic sort of thing. So after that, he said, though, like, just to give you peace of mind, and me peace of mind is probably, you got a bug or like a flu. Let's do a CT scan. So we did a CT scan, and then he called me a week later, or a couple days later rather, and was like, okay, you're good to go. Nothing's there. I said, okay, great. And then 2 weeks later, so that was in November, I think it was the 27th they did the scan, and the 29th or 30th he's telling me that we're fine. And then I had an MRI booked at a different hospital for something entirely different. And unfortunately, they found a brain tumor. So essentially, it turned out, so I'll just skip to the part. So that hospital did not tell me for 6 days, and I had signed up, on the hospital walls, they have those, charting things that they say, download this app and put in your email and we'll let you know, and you can see your own scans, you can see your own reports, etc. So I downloaded that, and it was 6 days later, it was December 14th, it was a Thursday night at 7 o'clock, and I got an email saying my scan results were ready to read. So I just wanted to be sure because of the headache thing, but also I wanted to see for what they were checking for. I just wanted to see if there was anything on the report. It even cost money. I hesitated. I was like, do I want this? Do I really need this? Can I not just wait like a month or two? Thankfully, I did not do that. So I paid for it. I look at it, and essentially the report reads that due to Natalie's past, history of breast cancer, this should be looked at for metastatic disease. And unfortunately, they were saying it was a brain tumor, and it was 2.7 centimeters or 2.6, somewhere along those lines. And yeah, so I gasped like, and then my sister took my phone and looked at it, and she started to immediately get mad, like saying, how can they have this here? How can you be reading this here by yourself? Like, there's no doctors we can call. It's 7 o'clock at night. My mom was really worried as well. And so I called to tell my fiance, and they were all saying, well, what if it's something else? But just right away in my heart, I knew that HER2 positive can often go to the brain. I was obviously hopeful that it wouldn't. And of course, they called me no evidence of disease for over a year, about 15 months, 16 months. So it was shocking. And I don't have any other metastasis that we know of, like knock on wood, like thankfully. So it was shocking. And so what happened was I went home and, we all continued to discuss further. The next day I called my family doctor because I figured, okay, she got the information same as I did. They had no idea, so I had to email it to them. I also called the hospital that did the scan because that neurologist that I had actually just retired, so I was getting a new one. So I know if she had seen the results, she would have made sure I knew. But nobody called to tell me, so I was really mad about that for a while. Because how can you let me just walk around? Like, what if I'd had a seizure or like driving my kid around? Like, you can't. I don't know. I was just angry and well, I was shocked, but it's also like you do need to tell people. Like, how can you not tell people? So then I also had to call my oncologist, and I had to inform my oncologist that I had metastatic cancer, not the other way around. So that was really strange that I'm telling my oncologist. So after that, that was on December 15th at 4:00. He confirmed that I did have metastatic disease. They do believe it's a brain metastasis. And also he went back and checked the CT scan, and turns out that, it really was there. It was about 5 millimeters. So 5 millimeters, 5 centimeters, 5 millimeters. So it had times itself by 5. By the time that I got, actually, now that I'm thinking about that, it was only 5 millimeters. That's less than a centimeter. Anyways, I think it was about 5 times bigger by the, I could be totally wrong. My math, or maybe I'm just confused on it right now. But anyways, it was about 2.6, 2.7 centimeters, but before it had been only like 5 millimeters. So it had really grown extensively, and that was only in 10 days. So I got scared, really, really scared, because HER2 positive, I saw how quickly it changes and grows and morphs. And thankfully, then it stopped growing. So I don't know why. Obviously, it's God. So he did not allow it to grow any further. And so I ended up having to have another MRI at my home hospital where they were doing my cancer treatment. And then I was referred, after I talked to the radiation oncologist. She suggested they had better machines down at a different hospital. So I was told I had to do gamma knife, and all this is happening within like a few days. Like, my oncologist had said, sorry, you're right, Natalie, it is metastatic and you're going to probably start radiation next week. It's just before Christmas. It's December 15th. And then I got really scared because we all know stories of people who go down really quickly. And I'm thinking, are these the last birthdays that I've had with kids? Is this, are my nieces and nephews going to remember me? Are my kids really going to remember me? Am I going to have another Christmas? Just all the things. Mostly it was about kids, right? And just really realizing, like, are my kiddos going to really know like who I am, or am I going to be here very long? So, and how am I going to prepare them, really? Because I know for me, like, there's nothing I can do if it is what it is, right? So I started to feel like I have to get certain people prepared to be able to handle this. Anyways, so from there, essentially I tried to have a really fun Christmas. I had to start taking steroids, which were awful. I felt awful on them. And they also made me go manic. So that was another problem. And then we had to put our cat down, and we ended up getting 2 kittens. That's a fun part of the story, because I felt like we really need some joy. We really, really need some joy. And probably if I hadn't been manic, I might have brought 1 kitten home, although I love cats and I love animals, so I might have brought 2 home anyways. And yeah, essentially I started Gamma Knife on December 27th, right after Boxing Day. I had to do 5 treatments of the, I think it's called SRS. So 5 days of it. It was about 35 minutes each. That I didn't really feel anything, except it was just like a little scary because you had to have a mask on. I had to get custom fit for that, but they just kind of like, it's just like really tight, and they hold you down, like, good thing. And if you move, like, I think it's like a millimeter, the machine will completely shut off. So that's good because they are using radiation on your brain. But I didn't feel anything in that 35 minutes, like I said, except I didn't love to be in that position with my face, like, but that went really well, and I just felt tired from it. And all I've noticed, so I finished that on January 2nd, 3rd. I think it was like the 4th, maybe the 5th. I think the 4th. Anyways, we did 5 days of it, but there was New Year's in between, and weekends they don't do it as well. And then they basically told me I just have to wait till the end of March when they rescan to see if it's working or not. They also told me the chance of that working is 50-50. So I'm positive we're going to be on the good side. But then, sometimes the doubts creep in, and I get a bit nervous. But the only real symptom I've noticed is my short-term memory. I'm finding it a lot harder to remember the things I want to say. And I'm also noticing that I have some stuttering sometimes. But other than that, I think everything else is pretty normal. Also, well, I should say I'm also feeling a little unbalanced as well. Like I don't feel as stable on my feet. And so I have like a rollator if it's really far, or like a cane, just something, or like one of my friends or family to hang on to, just something so I feel like I'm more comfortable. That's gone away a little bit. So now we're just waiting. So it is now February 10th, and it's 2024, and we're just waiting till end of March. And so when I had asked the people in the radiation area, what should I do in the meantime, they said, just live your life, just live, because I'm sure, and I think they've seen people who've, got the good news and some who've got the bad news that it didn't work. So obviously they're saying, like, just, live your life and as much as you can. So it's just, it's the waiting. The waiting is the hardest. It was the same in the beginning when I had stage 3, and I really would give anything to have stage 3C right now, start all over again. Because for me personally, this was, like I said, any stage of cancer is scary. Like, we all know that. But once I heard stage 4 metastatic disease, I'm trying not to freak out. I think part of it is some denial. It's now been almost 2 months. So I guess, like 55 days or something. It's almost been 2 months that I've known this. And I think I'm still in a bit of shock and denial because, like, this can't be my story, Again, of course, it's not like, why me? Because I know why me. Like, there's kids who get cancer. Like, why not me, right? I don't feel sorry for myself. I just want treatment to work. And I also am just like, no, I have no evidence of disease. Like, we did that. I beat it. We're good. So I think there's some strong denial that's still trying to protect me to be able to absorb this. I've definitely had anger, like I said, about not knowing, mostly I'm angry that they didn't catch it mid-November because my doctor had said, if they catch it really small, they can make it go away. It's also in an inoperable spot. So they need to shrink it in order to operate. And normally, if you said we're doing brain surgery, I'd probably be terrified and go, like, not hide under the covers, but, I'd be terrified. And I'm praying for having brain surgery, which, sounds crazy, right? But I think there's like some level of like this, like, detachment, like this is not my problem or my story, but it is. And so I'm just trying to, I guess, approach it and handle it the best way possible. I am not strong without God at all. And I'm sorry, I haven't really brought up my faith in God and Jesus. Most of this, I just wanted to get through this without my kittens wrecking it and all the background noise because I've had to redo this a few times. But God is number one in my life. He's the center of the world. And I know that he's walking me through this for a reason. Maybe it's to get to someone, to reach someone for the kingdom. If it saves one of my family members, it would be all worth it because I come from a family mostly of non-believers, like agnostic or different religions. And so if that's God's purpose in this and it saves one of them, then it's worth it. I know I am going, like, I know my salvation, I know my Savior, my personal Savior is Jesus Christ, and I know that I will be safe in heaven. I need to share that with everyone as well. And I know that, see, now we have a kid coming to make noise. Of course, it's the other kid in now. Anyways, I know. So I don't know the purpose for it. Obviously, none of us know the purpose for anything, right? For all these things, but I am happy and glad to do things for the kingdom. This is what God wants. I'm hoping that He wants me to, just go around and not shut up, about the kingdom and not in a rude way to myself of not shut up, but like really explain and tell people that God is for real. God is real. Jesus is real, and it's what we all need. And maybe, like I said, if it saves one of my family members, not saves, like I don't save it, but if God is using this to plant a seed for one of my family members, like we don't know, the design, and we don't know the reasons why. So I don't think, why me? That's what I'm trying to say. Why not me? I just really, really, really hope that if I walk through this, that I'll come out with a happy ending, what I would consider a happy ending here, rather than not. But God loves us infinitely, and He does not put us through things to punish us. And so a happy ending for Him could be either is like still here or in heaven. And of course I would be happy to be in heaven, but I need at least probably 11 more years before I would not be worried at all. And of course I trust God. I trust God. It's just hard as a human not to worry. It's hard not to worry, right? Especially moms. So I just feel like, just need at least 11 more years. But at minimum, I hope for at least 2 or 3 years. Anyways, so I just really want people to know that this is a serious illness. And then even if you think you're fine, you might not be. And so really enjoy your time. Same message I have to people who don't have this hanging over their heads. A lot of people will say, well, all of us don't know. Like I could get hit by a car tomorrow. The idea of maybe getting hit by a car tomorrow and your time might seriously be up in a few months or a year or two totally different things, because it's coming. It's like you're watching the train or the bus or the car come at you. And so I know people mean well when they say that, but I really don't think it's the same thing. Like, yeah, it's like more flippant. Like you don't think it'll actually happen. Or at least I didn't. Like I thought my one granny lived till 90, almost 91. And her parents were 87 and 88. So I really was going off them. I was like, I got good genes. I'm here. I'm good. And so I was prideful in that. And I just really thought nothing was, like, I didn't think I wasn't going to live to be an old lady. So I hope that I do. And I know God is working through this. Like I said, I guess my story is that I just want you to let people know in case it happens to them, but also to advocate for your help for your health, and also to know God and Jesus are really real. And I hope this channel blesses you in some way, and I hope that this story has helped you. Thank you if you've listened to this whole long-winded thing, and I'll see you next time. Take care.